Okay, so you've probably thought this before. I just want to feel better without all that complicated medical stuff. I don't want 10 medications. I don't want confusing plans. I don't want to feel like I need a medical degree to understand what's going on. I'm Dr. Lola Ashaye. I'm a board certified family and lifestyle medicine physician and founder of InTouch Primary Care in Sugar Land. And at InTouch, we don't just treat symptoms, we change how people experience healthcare. Many of our patients come in feeling frustrated, unheard, or overwhelmed after years of rushed visits and unclear answers. So we focus on slowing things down, truly listening, and connecting the dots in a way that brings clarity and confidence so that people can understand what's happening in their bodies and know what to do next. So I remember a patient who told me, I don't want anything complicated. I just want to feel like myself again. She was tired. She wasn't sleeping well. She was waking up drenched in sweat. She was gaining weight. Her mood was off. She thought she was losing her mind. She had palpitations. She had frequent urinary tract infections. But what she feared most was actually not her symptoms. She just didn't want to be put on a plan that she didn't understand. So let's start here. What does complicated actually mean? So, for many women, it means being on multiple medications without explanation. It means feeling rushed through decisions, not understanding why something is being recommended, or thinking that the only option is hormones and not understanding or fearing them. So let's simplify what's really happening, okay? So the reason people during menopause transition can have so many symptoms is because there are estrogen receptors all over our bodies, in our brain, in our skin, in our hair, in all many organs. And so when the estrogen hormones are declining, it's going to cause a lot of symptoms, like I had mentioned some of them earlier. And by replacing estrogen, which is what happens when people do hormone replacement therapy, it starts to support their brain function again, their mood, their skin, their vaginal health, and so many other functions. So that's what's going on. There's another hormone called progesterone, which also helps support estrogen and very needed if you have not had a hysterectomy. And even if you have, you can use it to support sleep, calmness, and can help with cycle regulation for those that still have periods. And then testosterone supports energy, strength, and libido. Okay. So those are the three main hormones that are used in hormone replacement therapy. And they can be used during perimenopause and menopause. And it's important to know that the reason people are having symptoms, especially people have more symptoms actually a lot of times in perimenopause before they actually stop their periods for a whole year. And that's because the hormones are fluctuating before they actually completely decline. So that's why many people feel mentally off. They have brain fog, mood changes, they feel physically drained, they have fatigue, poor sleep, and different body parts are affected. But the transition is different for every woman. Just like in pregnancy, no two experiences are exactly the same. So here is the part a lot of people miss. There are many options, a full range of options, not just one path, not just hormones, not just pellets. Okay, there are many options. And what can simple look like? That's what I'm going to talk about. So sometimes the most effective changes are not complicated at all. Sometimes it's just lifestyle changes like improving sleep routines, adjusting nutrition, increasing protein, making sure blood sugar is balanced. It could be strength training for metabolism and bone health. It could be stress regulation, which really matters and a lot of people underestimate. Or it could be supplement-based, evidence-based supplements. So like it could be, for example, berberine, which supports blood sugar balance, insulin resistance, and can help with weight and metabolic health. It could be curcumin, which is a turmeric extract, helps to reduce inflammation, can help with support joint pain, metabolic health, and overall well-being. It could be myonistal, which supports insulin resistance, mood, metabolic health, especially helpful for women dealing with weight changes or prediabetes. So there are options. And yes, hormones are an option, but they're not the only option. For the right person at the right time, hormones can be incredibly helpful. But here's what matters. There are one tool, they are one tool, but they are not the only solution. And they should be part of a thoughtful, personalized plan. So, what does our process actually look like? We keep it straightforward. We evaluate your symptoms. We review your health history. We understand your health goals. We'll walk you through the full range of options. Then you get to decide what feels right for you. So, if you've been thinking, there has to be a simpler way to feel better, you're right. And you don't have to figure it out all on your own. If you're in Texas and I'd love to help you understand what options you have and to help create a plan that actually makes sense for you. This is exactly the kind of care we provide at InTouch Primary Care. It's personalized, it's relationship based, where you're not rushed, you're not guessing, you're not left to try to figure out this all on your own. Our goal is simple to help you understand your body, feel confident in your decision, and have a clear plan forward with a doctor who will actually get to know you, not just your chart. So if you're interested, schedule a free 15-minute consult so we can walk through how our services work, answer questions, help you decide if this is the right fit for you. The link will be in the bio. And if this has helped you, share it with someone who needs to hear this. So imagine that you're sleeping better, you have a steady energy again, your mood feels more like you, you're not overwhelmed by options, you're not confused by conflicting advice, you understand your body, and you have a plan that feels simple, clear, and right for you.